Greetings, friends and followers. This is Nurses Talking. I am Dil Barzi. And as always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here we speak to nurses anywhere in the world, at any stage in their nursing journey, from students through retirees and anywhere in between, and in any and every specialty. And today I'm very, very pleased to welcome Tammy Smit. Tammy is a certified registered nurse anesthetist. She's an education consultant. She's a business developer. She's co-founder and owner at 123 Owner Finance, and she's president of Texas CRNA Education. Welcome, 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 Tammy.
Thank you. So nice to be here.
I so appreciate you doing this. I know it's been a while. We've been going back and forth trying to get this done. So thank you.
Well, schedules are always the challenge.
That's the beauty of one of the beautiful things about nursing. We're never bored.
No, never.
So one of the things I really always want to know is why people are nurses. So why are you a nurse, Tammy? What brought you here?
Well, what brought me here was after I finished my first college degree, I was actually working in research in a major medical center in Dallas, Texas. And when I was there, I realized that my ability to get jobs wherever I wanted to were diminished based on the small niche that I was working in research, and that there wasn't a lot of flexibility there. And so I became quite alarmed at whether I was going to be able to keep my job after our research grants had expired. And there was a nurse working there, and she said, "Why don't you go to nursing school?" So I said, "Okay, let's go to nursing school." And that's what I did.
Okay. That was easy. It was a nice slide in. Okay. So having gone to nursing school and gotten into nursing, was it what you thought it would be?
No, not at all. It is far better than I thought it was going to be.
Excellent, excellent. So before becoming, first of all, what made you gravitate to anesthesia?
Well, I never felt completely fulfilled by not going to graduate school. I think that your dreams are inside of you and they just don't go away even as long as you ignore them, thinking all the reasons why you shouldn't pursue what you want to do on the inside. And so I kept pushing that off for other things in life, marriage, children, jobs, the time commitment. I thought I couldn't. It was too big of a hurdle. And I finally decided that I wasn't getting any younger and I should really go. And once I got into anesthesia, I found my people. I knew I was where I needed to be, and it was what suited me very well.
So what other areas did you work before that, though?
Oh, I had career ADD, and I still do. I worked, of course, in ICU, the emergency room, endoscopy. I was a float nurse. I was a travel nurse. I didn't want to stay in any place too long. And then I even did recovery room. I was in recovery room for 5 years before I decided to go back to graduate school.
Yeah. So you were really trying to find that niche.
Yes, I was avoiding what I wanted to really do because I was afraid of the hurdles that I thought were in front of me.
Yeah, I know that so well. I know that so well. Is there anything you would like to see change about nursing?
Yes. I would like to see advanced practice nurses be able to function to the full practice authority in every state. We are limited, we are trained to do certain things within scope of practice, and then the political arena limits our scope of practice. And I think we made great strides during the pandemic. And we show our value as advanced practice nurses, and I would really like to see that we can practice to our full practice authority.
Yeah, and I'm glad you said that, because I do see that advanced practice nurses are actually really stepping out more and becoming more of a more, I don't even want to say in your face, but certainly, a little more seen, a little more taking the reins. So I'm happy to see that. I'm happy to see that. So I see that a lot of what you do now has to do with education.
Yes.
Why?
Why? Again, it's who you are. And so I've always been teaching. In undergrad, I taught science laboratory courses, and it's always been about who I was teaching. And then that my Texas CRNA education business really came from an opportunity from a coworker who said, "Hey, Tammy, we need this education and you really need to do it." And again, I was my usual self and said, that seems like too much work. I really don't want to do that. And they came back to me another time and said, "Tammy, you really need to do this. Nobody's doing it, and we really need to solve this problem." And I said, "Well, maybe I'll look into that." And then the rest is history. Since then, we have the education classes, and then we've branched out to take our side hustles with teaching CPR and teaching others how to get a CPR business, because you can use your nursing skills to do just about anything in this life.
Yes, 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 yes. And that is, you just articulated one of the big goals of this whole channel, because that is what I want. One of the things that I want to show nurses is that there are nurses out there doing all kinds of things. You can do it. So many things.
You can take all of your things that you learned, your time management, your assessment, planning, implementation, evaluation, those are all multitasking. All those are transferable skills to feed in to build the dream that you want. So nursing isn't always bedside nursing. If you want to do something that suits you better, go find it or go create it. And there's going to be a need for it, and the money will be there.
Yes. Yes, indeed. Yes, indeed. Yes, indeed. And it's such a beautiful thing. And I'm so hoping that we can see that because it only makes us stronger when we recognize just how transferable our skills are.
It's whatever you want to be. If you want to be a mom, you're always going to assess your child. What are they doing? Do I need to do anything about it? And did that work? And it's the same thing in building a business. What's the problem? How can I fix it? And then did it work? And can I make it better?
There you go. There you go. That's and those steps, as long as you follow those steps, you're good to go. You're good to go.
You can do anything.
Now that we're talking about these businesses of yours, one of them is in finance.
That is actually real estate.
Okay.
And I'm really big into making money. If you said, "What is your hobby?" and I would tell you, making money. I love to make money because your dreams need money. Whether it's getting a dream vacation or a dream car or not working those extra shifts, your dreams need money, and mine do too. And so we went into real estate, or I went into real estate as a single mom. I went into anesthesia school as a single mom. And, just bit by bit, I would challenge myself. Okay, I'm going to get off Starbucks coffee. How can I save that $5 a day and make it pay me instead of me paying for coffee of all things? And it turned into a rental property. And then we built when I say we, at that time, it's me and my two girls, we built a business out of that. And then we added rental properties to it. And so that's where the 123 owner finance comes from, is some of the homes are owner financed, or we acquire them through owner finance. So that's where that business comes from.
That's awesome. And that again, that's probably part of your personality too. You said you like to make money, but also some of that strength comes from being a nurse.
Oh, yes, definitely. I mean, you're not afraid of hard work if you're a nurse.
Exactly. Yeah. If you were, you wouldn't be.
You wouldn't be in nursing. And, that's what I want the younger nurses to know, that go into nursing and go, what did I do? This is not what I thought. I don't like it. I'm going to quit nursing. But don't quit nursing. Just go find what you want to do. It doesn't have to be the situation that you're in that you don't like, that makes you dislike nursing. Just go find a different situation that fits you. Don't quit nursing. Your skills are too valuable.
Exactly.
You work too hard.
Exactly. And that's another thing. You said it very, very You articulated it very well just now. You said your skills are too valuable. I don't think that we understand just how skilled we are. We begin to take those skills for granted and think that, that's just what you do. No, not everyone has those skills. You have very unique and very transferable skills. And you can take them anywhere.
And they can transfer into anything that you want to do.
Yeah.
But don't leave nursing. Don't leave nursing. Just find that aspect of nursing that appeals to you, or create that situation that appeals to you.
So as we're talking about that, because now we're talking about people who are already in nursing, but one of the things I want to know is, having been a nurse, what advice would you give to someone who wants to be one?
Who wants to be one? Well, if you've ever followed any leaders in business, like Richard Branson from Virgin Music, Virgin Airlines, Virgin Space, whatever thing, he has this great phrase that I just love, and I'm going to use the more appropriate version of it. And it says, "Screw it, just do it." Yeah, because my first husband told me, "I don't think you're going to be a good nurse." Sorry, he had to go. The nursing has lasted longer than he did.
Just do it.
Yes, just do it. And that means to anything. If you're in nursing, you don't like it, and you want to do something else, or you want to be a travel nurse, or you want to, go to Europe, screw it, just do it. It will work out.
Yeah.
I wish I would have followed that as a younger nurse.
Yeah.
It'll work out. Go do whatever you want to do. It will work out.
Yeah, indeed. Indeed it will. Indeed it will. I've been trying to see, let me go back. One thing. We're talking about, I'm speaking a lot now as I talk to nurses, and we're talking a lot about burnout and lack of care. And I noticed that a lot of us, when we talk about burnout and we talk about this disease in nursing, we're talking about a lot of things outside ourselves. We're talking about management, we're talking about salaries, we're talking about, working conditions. And all of those are very, very valid. But we're not talking a lot about us, what we contribute to this disease. I believe a lot of it has to do with us not properly taking care of ourselves.
I agree.
And so I need to ask you, what does self-care mean to you?
Self-care is very diminished as a nurse. We always put other people before us.
Yeah.
We make excuses. Oh, we got to take care of this. We got to take care of that. And if you're a mom, it's always about everybody else first.
Yeah.
And now that my kids are grown and out of the house, I realized that I needed to take more me time, and 15 or 20 minutes a day of me time, quiet time, whether that's quiet coffee, music, prayer, whatever it is that suits you, just that 15 minutes will reset your attitude. And we don't allow ourselves or give ourselves permission to do self-care. So really, it starts with us giving ourselves permission to take care of ourselves.
Yeah.
Because when we do that, we are better equipped to take on the tasks of the day or the shift or the family or whatever it is. And I still work on that every day. I undervalued self-care, realizing it would give me more capacity to be a better person, a better nurse, a better mom, a better friend, whatever that was, had I only taken 15 or 20 minutes a day. And maybe that's too much for some people, but try once a week. Yeah. Some of us are guilty of not even doing it once a week.
I know. And I had to get there myself. As you say, you undervalued. I did the exact same thing. And I think a lot of us do it. In the first place, as women, I think intrinsically we do it. And nursing is still predominantly female dominated. And then as nurses, it's reinforced in our education that we do it.
Well, in the healthcare setting is, and even in anesthesia, where you don't get out of the room all day. You can't do things that other jobs can do, where you can toilet when you want to, where you can drink when you want to, where you can have a few minutes to have a healthy meal, because your breaks are 30 minutes, and by the time you pick something up, you're not sure if you can even complete a 30-minute break. We need to maybe mimic and emulate these other high stress positions like air traffic controllers. They have controls and policies in places so that they decrease the stress of the workload. And we just need to borrow that in healthcare and make it a more conducive setting instead of all the production pressure that we have.
Exactly. And if we don't make it a practice to take care of ourselves, we cannot demand that other people take care of us, and they won't.
Oh no, and not in a capitalist country in the U.S. where our hours are spent generating revenue, and if you're not working, you're not generating revenue. And again, it would be nice if we could adopt the self-care model where maybe just 15 minutes out of your 12-hour shift, you're allowed to just decompress and take care of yourself.
Yeah, indeed. We may get there. I believe we will get there, and I believe we will get there because as nurses go after higher and higher education, more and more education, and become more and more self-sufficient, we put ourselves in a position to demand more respect and more concern for our daily well-being. And so at some point, I think it may be slow, but I think we'll get there somehow.
Yeah, the models will be introduced, like you said, ever so slightly, especially as we go into another era of nursing staff shortages. And people are not looking after the pandemic to flood into nursing as a career because of the very stressful and emotionally difficult environment it was. And there was significant risk to your personal health and your family's personal health that nobody's flooding to nursing. And those who were the heroes that stood by and took care of people during the pandemic still have to live with the demands that placed on them emotionally.
And it really, it's PTSD.
It is PTSD.
It's an epidemic of PTSD that we have now.
My colleagues who went to the forefront, who were able to, who again felt that calling to go provide care when New York was the hardest hit, they still have difficulty. They will not talk about their environments there. And the things that they did share, all of us grieve with them.
Indeed. And that is so very true and so very sad. I am looking to see what we see in each other as nurses, because sometimes I can just recognize a nurse on the street. I can look at somebody so I wonder, what is it that we see in a person? What do we think as essential qualities of a nurse? And so I'm asking this question. If you could describe the most essential quality of a nurse in just one word, what would that word be?
There's so many aspects that come to my mind immediately, but one word would be dynamic.
Dynamic. Okay. Yep. That's a good one.
Dynamic.
That's a good one. And we have to be.
Yeah, there's so many other things. My first one is bossy. When you go to nursing school, you're so timid and you wouldn't talk to anybody. A couple years into nursing, you're directing traffic, you're triaging.
You were very generous. You said a couple of years.
Well, yes, I know. I mean, it's your first year out of nursing school. You learn, oh, we're not doing that anymore. Let me tell you how it's going to be done. That's normally how I recognize another nurse in public, is just their ability to take control of the situation.
Yes. And to see the whole picture in a glance.
Yes.
And to see the whole picture.
It's a gift and a curse at the same time.
It most definitely, it most definitely is a gift and a curse at the same time.
Yeah, not everybody appreciates your perspective that quickly.
Oh no, oh no. And sometimes, you have to be a little bit pull it back just a little
Yeah.
bit and
Oh
go
yeah.
slow and recognize that, not everybody's coming through with you. Not everyone is able to think in parallel lines or at the same time. And
Yes.
um,
It's a
all of,
challenge.
it is a challenge. It is a challenge, but one that I would not change if I became a nurse in the mid 1970s. And after all this time, if I had to go back, I would do the exact same thing. It's not one that I would change if I had the opportunity to. So I can
I
think
would
of.
have joined sooner. I wouldn't have wasted my time on a different degree, although that degree benefited me when I wanted to get into anesthesia. So I would have done anesthesia sooner, and I would have gotten involved with my state organizations sooner.
Mm-hmm, 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 mm-hmm. Yeah. So what? Speaking of doing things sooner, um, over in the time that you've been a nurse, what changes have you seen, and are they good?
What changes have I seen? Um, in nursing. I guess the changes I feel that I hit the generation gap with is the expectations of coming into nursing and the idea that they don't really know the environment and the load that they're coming into. And so I would like to see a more realistic education of what the job entails, because I think that
Yeah,
it would provide more job satisfaction
yeah,
to bridge that gap. And so I see, yeah, I just feel like an old nurse. But I think that making it realistic, and maybe we need to have some sort of education component, because that would be me, and maybe a shadowing of a nurse, just like we do with students who want to go to anesthesia school. They're required to come shadow a CRNA when they want to
yeah,
go to anesthesia school.
yeah,
Maybe we need to have more of a shadow like program for our entry level nurses so that they get an idea. Because do you remember the first time you approached a patient in nursing school to give them a bath? How horrifying that was, that you were going to see somebody naked and you were going to have to wash that part. You know, when you maybe never saw that part other
yeah,
than,
yeah,
I don't know, maybe you never saw that part before. And nobody ever talks about that stress that's going to be there, or, what do you need to accomplish? So we
yeah,
do better things. We don't give complete bed baths like we used to. So that's an improvement, because we have better techniques now. So better techniques are good. But I'd like to see helping our nurses, our young nurses, come along and find the more positive aspects of nursing, because it's tough
it's
and being
very
short staffed is tough. But
very
let's nurture our newer nurses, let's nurture ourselves so that we can continue to function in nursing. Because if we're tired and burned out, it's usually not because we don't want to be a nurse. We just don't want to be tired.
We just don't want to be tired.
We just don't
Exactly,
want to be tired anymore.
exactly.
We're tired of being tired. We're tired of not going to the bathroom. We're tired of eating pizza for 30 years.
You know this, you know this, you know this, you know this. The one thing I think that could probably help is that our education of nurses is not recognizing that the structure of healthcare has changed. When I became a nurse, healthcare, it seems to me that it focused primarily on health, or at least caring for people. Hospitals were not part of these big conglomerates, and you were in an atmosphere that felt like a healthcare atmosphere. Now people in a corporate atmosphere trying to deliver healthcare.
Mm-hmm. We
And
have corporatized and monetized healthcare.
yeah, and you didn't, when you're in nursing school, that does not even come up. So you come out of nursing school, and nurses come out of nursing school expecting a healthcare type field and being thrown into a corporate environment, and they're floundering.
Sure. And I really don't have an answer for that because we've really corporatized healthcare.
Yeah.
And it's for nursing, it's a even bigger moral dilemma. You know, how do you care for somebody? You've taken a commitment and an oath to care for somebody, yet we have to see people that access healthcare sicker or undermanaged,
Yeah.
and they leave the healthcare institution sicker and maybe no resources. But again, that leaves a lot of opportunity to create something that meets the need of those individuals.
Yes, exactly. Leaves a lot of opportunity to broaden, for want of a better word, broaden the footprint of healthcare.
Yeah. I mean, home care nursing, caregivers at home, you know, even if you're not doing the caregiving yourself as a nurse, you can also have education business. You can run the business that allows, you know, caregivers to go out. There are so many things that can help manage that so that you see the need of sicker patients not accessing care. Then if you don't want to be at the bedside, go find a way to meet the needs outside of the bedside.
Yeah. And we're nothing if not creative, so we should be able to do that.
Sure, we are resourceful. Yeah, we are resourceful as nurses.
Yeah. Tammy, thank you so very much for this conversation. It's been enlightening.
Well, thank you.
Thank you so much.
And thank you for what you're doing, Dale. This is awesome so that we can promote the profession of nursing and realize that we're a community and we're here to support one another. And nursing is a great profession. So the things that we don't like about it, they can be managed, or, you know, create the environment that you want to work in.
Indeed we can. Thank you so much, Tammy.
All right, you have a great day, and I look forward to talking to you again, Dale.
Okay, bye-bye.
All right, bye-bye.